Lipat, ano ka ng konti? Ganyan. Okay, ready? Okay, so this vlog will be about the Kangaroo pump machine. This one, using the e-pump tubings, okay? These are called the e-pump tubings. And you see, it used to be only this one for the feeding, but this time, there is already a flush connected to it. Okay, now, we use, in my case, we use this sterile water, okay? And for the patient's feed, we use the Tucal HN. Now, when it comes to the feed, it always depends on the dietitian's orders, okay? What kind of tube feeds she wanted to order, then that's what you are going to follow. All right, so earlier I've already placed the feed here and the flush. Okay, now this is the Kangaroo pump, and make sure that it's always charged. Okay, now I am going to prime first like an IV line. Okay, so when you prime it, insert it like this. Okay, so it's the common sense that if you insert like this one, you see this point here will not be able to fit in the tubings, right? So you have to insert it this way, okay? And then roll it like this, okay, like that. Now, since you are already here, then it's time to close the cartridge. That's a cartridge, and I am closing it now. Okay, now, since it's ready, I am going to switch on the pump, the Kangaroo pump machine, okay? So, switch it on. It says there, Kangaroo e-pump. Then, there will be instructions which says keep settings and or clear settings. Okay. Usually, when a patient has been with you for a longer time and he is in a tube feeds, what we do is we always keep the setting. Or if it's a new one, then we go all over. Okay. So in this case, I'll keep the settings, but I'll show you. So that means that the rate is 200 mils per hour. That's the feed, okay? And the flush would be 150 mils per hour, okay? But we will not touch the flush, the flush, because the instructions for this patient is every after feed. Some patients will have a continuous feeding and they will say every 2 hours or every 4 hours. But this is a different kind of patient. So what I will show you today is we are just going to prime the pump. Okay. So touch here, the settings will be like prime pump, adjust feed, adjust flush, run, or let's say this is a hold one. Now, if you are doing your cell phone every day or your computer, it will be easier. So this is prime the pump, and you just don't press it like that one. You have to hold to prime the pump. Okay, so I will hold it. Now, if you could listen or you will hear that kind of sound, that means it's already priming the feed. So you'll see that it's coming down, okay? So it's coming down now. So once the feed is already at the bottom, I'll stop. So there it stopped, right? Then I will go to prime the flush, okay? So I will hold the flush on this area where it says hold to prime flush, okay? So I will hold it. And by the way, you make use of this one because it will spill on the floor, okay? You might use this one or a cup, okay? Now I'm going to flush it, hold to prime flush. All right, you could hear the sound of the flush the same way. Okay, and you could see it, it's getting whiter. And then that's it. I will now stop the flush. All right, so it's all done. I primed the feed, I primed the flush. So I will just say it's done. And then I am ready to hook it to the feed, to the peg tube, okay? And then I'll just press run, okay? Now, remember that there should be a label that you will place in here. The label will tell you the name of the patient, the room number, the rate of the feed, and the volume of the feed, and the date for today, okay? So this is the Kangaroo pump using the e-pump tubings, the feed, plus the flush. Okay, thank you.